February is heart month, so that means we all should be more conscious of our hearts and in particular the health of our heart. So I'm often asked by many patients, so what is it with the age? Why do we all age? And I have talked and give lectures about aging and anti-aging quite a lot of times. And there's different reasons why we age, but with regard to the heart, keep in mind that one of the main reasons why we do age is because our blood vessels become stiff. They lose the elasticity, and the elasticity is essential for appropriate perfusion and circulation of all our organs, including the heart. So that stiffness leads to something which we call endothelial dysfunction, which is basically losing elasticity. And as a result of endothelial dysfunction, oftentimes we see then the accumulation of plaque, calcium plaques, cholesterol plaques, within the inner layers of the blood vessels. And those calcium plaques then in turn can lead to a progressive reduction of the luminal diameters, leading to a blockage or stenosis in the arteries in the heart that can lead to chest pain, that can lead to what we call myocardial ischemia, lack of oxygen, and it can lead to heart attacks. So, and a heart attack in general can or is be a potential life-threatening condition. So, coming back to the heart month, that means we want to keep our blood vessels as healthy as possible. We don't want them to become stiff. We don't want them to develop atherosclerosis. We want them to keep them elastic. So how do we do that? The number one thing to do that is to exercise. And exercise is not always the same thing. Exercise usually means we have to get our heart rate up, we have to sweat, we have to feel it, we have to get short of breath. And the recommendation by the American Medical Association at this point for all of us adults is still 5 days a week, minimum of 30 minutes of moderate intensity exercise. That helps us to keep the blood vessels elastic, to train our heart, to keep our heart strong, and it helps us to be more conditioned, and it supports heart and vascular health. More to come.